Good afternoon. My name is Howard Tipton. I serve as the County Administrator for St. Lucie County. This is March 23rd, and this is our 4:15 briefing. We're going to have an update this afternoon from our Health Department and from the Board of County Commissioners, as well as from the City of Fort Pierce. I want to start with just a few quick remarks, if I could. First, I want to thank everybody in our community for taking our messages so seriously. The ones that you've been hearing so much about COVID-19. The health of everyone in St. Lucie County is our priority, and it should be yours as well. These unprecedented times are a test for all of us, and it is a test that we will pass. Over the weekend, we've had to take certain actions designed to help support the social distancing message that some, however, just haven't seemed to understand. Closing public access to the beaches was one of those actions, and there may well be others. Please understand that no one wants to take these actions. However, when it comes to the public's health, we all have an important role to play. And right now, when we see large groups of individuals paying little attention to all the warnings that have been posted, well then, additional action is required. From boat ramps and island parties to large numbers of people playing basketball, this is not social distancing. Please, let's use a little common sense and think about others first. Please follow these guidelines from the federal agencies, the state, the health department. Washing your hands, keeping your distance, being a good neighbor by checking on those around you. These are all small but critically important things that each of us can do. If each of us does our part, we can slow this disease down and we can beat it. That's the goal. That's what success looks like. Now, I have one additional request, and it pertains to our blood supply. As you might imagine, the coronavirus has had a dramatic impact on our blood centers and people donating blood. Thousands of blood drives across the country have had to be canceled. Donating is safe and needed more than ever to help give the gift of life. I encourage you to find a trusted local blood donation center by visiting www.aabb.org. The life you save may just be the one of someone close to you or around you. With that, I'm going to turn it over now to the St. Lucie County Health Administrator, Clint Sperber, for an update. Clint?
Hello again, Clint Sperber. I am the Administrator for the Health Department in St. Lucie County. As of 3 p.m. today, there are 3 confirmed cases of COVID-19 in St. Lucie County residents. All 3 are home. All have mild symptoms. We monitor them daily to check on their health and to remind them of the isolation guidance. As far as our hospitals, all 3 hospitals, Longwood Regional Medical Center, St. Lucie Medical Center, and Cleveland Clinic, have gone to a no visitor policy. The only exception will be 1 visitor for pediatrics and OB. Testing. Capabilities have been ramped up by the federal and state government to focus on where community transmission is taking place. What we want to encourage residents to keep using prevention measures and monitor yourself for symptoms. If you become sick, call your healthcare provider for evaluation and to rule out other illnesses and stay home. If your healthcare provider recommends COVID testing and they currently do not provide it, what you can do is by appointment only. Cleveland Clinic Tradition and Martin North, they are offering testing, as well as Florida Community Health Center beginning tomorrow in Fort Pierce, but you must call first. What has been mentioned by Howard and what has been mentioned for the past several weeks, prevention is key, and everyone has the responsibility to prevent the spread of the virus. Best way to protect yourself is good hygiene. And our real focus is on everybody, but specifically those who are most at risk. So adults 60 and older and those with underlying medical conditions like heart disease, diabetes, lung disease are more likely to develop serious illness. Now, all the measures that have gone on and will continue to go on, again, the reason why we do these measures is because currently there's no medicine to treat COVID and there's no vaccine to prevent it. Thank you.
Good afternoon. I'm Chris Zadowski, Vice Chairman of the Board of County Commissioners. As we all are experiencing this new reality of COVID-19 pandemic, you should know that our main mission is to do the best we can to protect you by slowing the spread of COVID-19. There's no manual for this virus and how we transmit it and by whom. Simply stated, it means that it's not as much about the disease, but how we handle it. It's important that we limit our responses to each other, our interaction with each other. We need not overreact. We don't need to hoard supplies or food. It's important that we don't shut ourselves off from our family. Have that open communication. Reach out to them. It's not so much, again, how we deal with the disease. It's more about how we react to it. So the simple goal of this is protecting each and every one of us. So we are truly trying to protect you and each other from this disease. And so a few things we want to reiterate over and over. Keep our distance from others, washing hands often, limit contacts, refrain from putting your hands to your face, and try to relieve yourself from the constant messaging from the news. Find some distractions. Read a book. Again, try to limit yourself with the news. Please get your information from credible sources. It's important that social media is out there and oftentimes providing misinformation. So get your information from credible sources. And lastly, we will all come through this latest challenge in St. Lucie County because we're strong. We're strong individually and we're strong collectively. With that said, my money's on you, St. Lucie County. We'll get through this.
Good afternoon. I'm Linda Hudson, Mayor of the City of Fort Pierce, and we remain committed to protecting the health and well-being of our citizens and our community. I'm going to give a few refreshers. Fort Pierce City Hall is closed to the public effective today, but essential services like police, solid waste, and utilities will not be impacted by this closure. The building department can be contacted at 772-467-3199. As of today, beaches in St. Lucie County are closed. To remain consistent with our partner agencies and as a protective measure, Fort Pierce will close J.C. Park and associated beaches, as well as Causeway Park. All other parks remain open. We continue to strongly urge our residents and visitors to practice social distancing recommendations. We will continue to update you as information becomes available. All public notices regarding coronavirus are posted on the city's website, social media channels, and Fort Pierce TV Channel 27. This is a critical time. We are so fortunate to live in a free society. So you can imagine how reluctant we are to impose restrictions. But we have a big responsibility, and that is to protect our citizens. And you have one responsibility, and that is follow the CDC guidelines to slow the spread of the virus. Be smart, be safe, stay home, and stay healthy. We are Fort Pierce strong. And I'd like to take this time to thank our Fort Pierce Police Department, our Sheriff's Department, our Fire Department, and all the first responders and our healthcare industry that are on the front lines of this fighting this virus. Thank you.
Thank you all for that. Just a couple other points really quick before we close. I wanted to remind everybody that St. Lucie County remains at an activation level 2 for the Emergency Operations Center since we have a declared emergency. From the Sheriff's Office, the request is to keep social distancing front and center in everyone's mind. Help yourself and first responders who are serving this community by keeping them safe, by keeping your distance. The Tax Collector's Office continues to be open to the public and now will be offering access to seniors, that's age 62 and older, starting a half hour earlier than the general public. So if you are in that age group, 62 and older, you can go in starting at 8:30 Monday through Friday. Transit operations, while we've seen a big decrease in ridership, they are maintaining their current routes and time schedules. It's important because we want to ensure that people have a chance to get to the stores, have a chance to get to the doctor's offices, or get to work. The county has been working to implement a daycare program for our first responders and our healthcare workers because so many of them are 24-hour impacted. And so we've been working in a partnership with the Boys and Girls Club to make sure that we've got coverage for those people who need to get to work so that they can protect us. And then lastly, as I mentioned last time, I encourage you to take a few minutes to fill out those census forms. You're sitting around the house. It's a great opportunity to not only help yourself, but you can help your community for really the next decade by helping to bring down federal dollars to our community. So let's make sure we get those census forms in. And with that, we close this update, and we're open to any questions that there might be.
Mundane business, government business matters. You know, with budget season coming up, how does it look on the county's reserves, the revenues that have been coming in the last couple of weeks, and, you know, what you're going to be doing, planning for the upcoming budget with, you know, it looks like a major hit in revenue and all kinds of income and all kinds of slowdown in economic activity?
Well, thank you for that question. Yeah, it's in addition to thinking about how we respond to the current crisis, we do have to think about how we're going to be planning for this future. Certainly the tourism revenue is falling off dramatically, having the loss of half of basically spring training, and in the month of March being the busiest month, not only for St. Lucie County, but for the entire state of Florida. It's going to have a significant impact. We do have a reserve position where we, I think, are in good shape right now. It's unlike a hurricane where we have extensive damage that we have to rush to repair. That's not what this is. This isn't, as I've told our team, this isn't as much of a spending issue, although we are spending some additional overtime, especially for first responders. It's going to be a revenue challenge in the coming year and years, actually. And so we have to start thinking about services. We've got to think about how we can continue to provide that and be even more efficient than we've been in the past. So we have an eye on the future, but about 80% of our time right now is just focused on the present.
Two questions. One, did you say that a third testing center will open in St. Lucie County tomorrow?
Let me get Clint up here.
Okay.
Florida Community Health Center in Fort Pierce, and it's primarily for their patients, but you can definitely call up there. You still have to go through a screening process to make sure that you do qualify for the testing, but that will open tomorrow.
Thank you.
You're welcome.
And one more question, Howard. What changed from Saturday to today as far as the beaches are concerned?
I thought what we saw, and we're in contact with both Indian River County and Martin County as well, because we think of our beaches as a Treasure Coast resource. And what we saw was just a lot of non-compliance, unfortunately. Not the social distancing and the regard for the messaging that has been out there. And we're at a point right now where we're ahead of the game, and we want to stay ahead of the game. We don't want to lose this game, and so it's important to take these steps where we see large populations of people getting together, certainly exceeding the limits that have been suggested. And so we just had to take those sections. I would mention too that, you know, as you see parks, again, people, you know, wanting to get out and play basketball or pick up football games, you know, whatever's out there. This is just not that time. Parks right now are really just used for walking. That's what they should be used for. Some of the other sports and the other things, that will all come back in time. We will all resume normal operations. We're just not doing it right now.
Can you just describe, speaking of the parks, what park facilities are available and how you recommend they be used?
Sure. So essentially all of the parks right now are available for use, taking aside the Met Stadium and some of the larger complexes. But again, not the basketball courts, not the baseball or soccer fields. We're really not looking for large team sports right now. But anybody can get out and walk in any of our regional parks, any of our smaller neighborhood parks. It's a great opportunity. I mean, this is the best weather we have all year round. And so it's a great opportunity to get outside, as Commissioner Sadowski mentioned, get your mind on something else other than this disease. Just do it with your family or just by yourself. But all of the parks are still available.
We've seen a lot of people concerned about paying utility bills and whether or not government's going to be shutting off utility lines.
And so a couple of messages on that. First of all, still encourage you to pay your water bill. It's important. But during this time, there are no government actions that are going to be taken to shut people's water off right now. And I know the electric companies as well are working with their customers to ensure that that service is not interrupted. But it is important. Again, we all have responsibilities to make sure that we're paying our water bills and our electric bills. But we understand, and we're going to work with everybody to get through this.
Any questions?
So with that, we appreciate you joining us for this March 23rd update. And we do not have currently another scheduled press briefing, but as needs warrant, we will schedule one. So thank you for joining us.
We will do a short abbreviated briefing in both Spanish and Creole, and we'll start with Spanish. Thank you.
Resumen informativo del COVID-19. El personal de manejo de emergencias del Condado de San Lucie quiere implorar a nuestros residentes que presten atención a las advertencias de salud pública relacionadas con COVID-19, coronavirus, con respecto a la higiene, el distanciamiento social y las reuniones de más de 10 personas. La tormenta silenciosa que es el COVID-19, coronavirus, es una amenaza tan grave para nuestro bienestar como cualquier huracán mayor. Todos tienen la responsabilidad de hacer su parte y el éxito solo llegará cuando todos demos un paso adelante y nos lavemos las manos, mantengamos nuestras distancias y nos mantengamos alejados de las multitudes. Debido a los residentes y visitantes que no siguen las pautas, todos los accesos a las playas públicas del condado de San Lucie han sido cerrados, hasta nuevo aviso. Cierres adicionales pueden continuar. Si está enfermo o muestra signos de COVID-19, que incluye fiebre, falta de aire y síntomas similares a la gripe, comuníquese de inmediato con su proveedor de atención médica. Si no tiene un médico de cabecera, comuníquese con el Departamento de Salud del Condado de San Lucie al 772-462-3800 o sanlucie.floridahealth.gov. En este momento hay al menos 3 casos confirmados de COVID-19 en el Condado de San Lucie. Las líneas de información pública del condado funcionan de lunes a viernes de 8 a.m. a 5 p.m. Ese número es 772-460-HELP-4357. Las escuelas del condado de San Lucie permanecen cerradas y el personal está trabajando en un plan para ofrecer aprendizaje digital. Para obtener más información sobre las escuelas, visite www.sanlucie.k12.fl.us. Ayúdenos a detener la propagación de este virus practicando el lavado de manos adecuado, limitando las reuniones a menos de 10 personas y quedándose en casa. Para más información adicional, visite www.sanlucie.gov/COVID-19.
Bon après-midi, Pep St. Lucie County. Travailler dans le bureau emergency de St. Lucie County dit pour tout résident faire attention à l'avertissement santé publique qui est associé avec coronavirus. Coronavirus, c'est une maladie qui est grave. Tout le monde a une responsabilité pour y faire participer. S'il vous plaît, restez propre, faites pratique distance sociale epi pa rassemble nan kote ki gen plis pase 10 moun. Accès tout l'anmen public St. Lucie County fermé, parce que résidents ak visiteurs pa pran précaution. Si ou malade ou soit ou gen symptômes coronavirus, c'est la fièvre, souffle qui coûte, ak symptômes tankou grippe, contactez l'hôpital ou soit docteur immédiatement. Si ou pas gen docteur principal, contactez le département de santé dans St. Lucie County. Numéro ça, c'est 772 462 3800. Pour Kounia, nous confirmons qu'il y a 3 personnes qui sont infectées à coronavirus dans St. Lucie County. Ligne information publique ouvrie lundi pour vendredi, 8h pour 5h. Numéro ça, c'est 772 460 43 57. L'école dans St. Lucie County était fermée. Mais il y a travail sur un plan pour offrir aux gens une option pour apprendre sur net là. Tant pis, rester en sécurité et puis aider nous continuer à suspendre le virus là. Lavez main nous, kembe distance nous, rester loin côté qui gagne rassemblement plus que 10 moun et puis rester là quand sous capable. Merci beaucoup.